So the next segment is what we call we should have known better. And you'd think by the mid-1900s, we'd be using science as our compass, but the list of medical reversals proven wrong after decades of use tells a very different story. Until 1955, we were using radiation on thymus glands of children to prevent breathing issues. It didn't. Instead, it caused cancer and destroyed their immune system. Until 1960s, doctors were recommending smoking for asthma. That's right, smoking, inhaling burning leaves somehow made sense for asthma patients. And until 1970, the prescription for heart attack was plain bed rest for a month. No walking, no movement. Just lie there and probably wait for another blood clot to do the rest of the work. Until 1985, we were performing radical mastectomies for early breast cancer. That means removing the muscle, the bone, the tissue, the breast, long before evidence showed that less intervention was more. And until 1996, women who were giving birth were routinely given an episiotomy where they would cut the perineum with scissors because somebody decided, oh, nature needs some help. And it just worsened the recovery. And then even until the 21st century, the century we're in now, we're still learning the hard way because these medical opinions haven't stopped yet. Until 2002, hormone replacement therapy for women, we thought it protected hearts. It didn't. It showed increased cancer and increased heart disease. Until 2007, millions and millions of patients were getting coronary stents for stable angina. There wasn't any survival benefit, but there was a significant surgical risk. Until 2009, mammograms for women under 50 were pushed as life-saving, but now we know that there was more harm from false positives than any life benefit. Until 2013, arthroscopic knee surgeries for meniscus tears was routine. It's still going on today. I have patients that do it today, though we know that therapy works just as well, or if not better, without the scalpel and without the recovery time and the pain of surgery. Until 2015, low-fat diets were recommended for heart disease, and now we know that it wasn't fat, it was the ultra-processed carbs and ultra-processed foods that are the problem. In 2016, we were still using opioids as compassionate solutions for pain, and now we're counting the cost and addiction and lives lost to opiate addiction. And until 2017, pediatricians were still telling parents to avoid peanuts for their infants when it increased peanut allergy risk. And in 2019, there were millions of people that were still taking aspirin for heart disease when we know it didn't work.